Hi, my name is Kelly Mercier. I am the principal investigator for the DTRF Natural History Study. I will be reviewing our study progress and current results that we will be presenting at the National Organization of Rare Disorders annual meeting later this fall. So just to catch everyone up, this project started with an open call for rare disease foundations or advocacy groups to join this process back in 2016. We developed with our esteemed colleagues of investigators and patient advocacy individuals a series of specific modules related to desmoid tumors between 16 and 17, and we launched the study in 2017, announcing it at the workshop and patient meeting in 2017. So as you can see, we have a lot of study objectives. This is a long-term study. The platform is meant for all rare diseases. We obviously are interested in desmoid tumors. So understanding disease prevalence, phenotypic information, anything about progression, and specifically about how treatments are being developed and are efficacious in these different subtypes. And then we really want it to be a resource for everyone in the community to understand this patient population better. So the kinds of questionnaires that we have in the study include monitoring, treatment, diagnostics, quality of life as the patients go through different parts of not only the diagnostic process, right, but also their treatments and living with their disease. About a year and a half ago, we also included comorbidities into the surveys. So some updates that we have, we've had some study team growth. We've had a successful presentation at the DoD Rare Disease CDMRP launch meeting. We've done significant data cleaning in collaboration with NORD, and we will be presenting, as I alluded, posters at the virtual NORD Summit next month. So our team has grown from just myself and Lynn Hernandez. We have Danny Braggio, who has joined us. She has extensive desmoid tumor research from Dr. Pollack's lab at Ohio State. Amanda Lucas also has a tremendous amount of clinical research experience and is a caregiver of a desmoid tumor patient. So between last year and this year, we've had a lot of growth in our study population. You can see that between last September and just the other day, I'm recording this in August, we have had more than 500 people register as respondents. Between that and starting surveys, we have grown from 479 participants to 627. So additional people are signing up, are submitting their information into this study. As I mentioned, we had a successful presentation at this new DoD meeting. This is a new initiative for the DoD to study rare cancers. They wanted to have advocacy group that does participate in rare disease research. So it highlighted how much the DTRF is doing, but also this particular study. So it served as a representative for that initiative. I urge you all to take a look at that if you are interested in funding for desmoid tumor research outside of the foundation. That money will be available soon. There has been a significant amount of data cleaning over the past year. We've identified a couple of issues that we had with the study in full transparency. Initially, there were blank surveys arising from delayed implementation of survey logic. for instance, men receiving pregnancy surveys or adults receiving pediatric surveys. So we've gone through and we've eliminated all of those in the past few months. We originally engaged with NORD to try to get this sorted out, but because of COVID, you know, we had issues with alignment, so it ended up being a manual removal, but there was a lot of back and forth between NORD to make sure that we got everything in a state that is much better. We also had some fraudulent profiles that were created the end of last year, and they've been removed from the database. So we've had 2 posters that have been submitted and accepted to the NORD Summit that will be in October of this year. One is an update on diagnostic data, and the other is treatment data. So I'm going to go through very quickly about some of this data. We'll be sure to share the posters when they are complete on the DTRF website so everyone can see the progress that we're making with the study. So the update on diagnostic data. So we first look at the locations of the tumors that are identified in this population. You can see that out of the 333 responses, about a third of them are joint and extremity. The next most population are the abdominal and intra-abdominal wall tumor types. And then for the patients doing that initial outreach for medical care for a diagnosis, patients are experiencing pain, unexpected bump are the most common, as you can see. And then for the types of diagnosis and frequency, you can see the biopsy, MRI, physical examination, CT are all at the top of the list, as you would expect. And for this particular question, patients had, or the respondents had an opportunity to choose more than one selection. But really the primary type is listed here, and you can see they're being diagnosed by a biopsy. For the question about unifocal versus multifocal is interesting, as most of the patients are reporting that they are unifocal disease status. However, as you can see from this pie chart, up to a quarter of the patients of this 278 who responded do report that they do have multifocal disease. So perhaps it is a little bit more common than what is described currently in the literature. Also interesting that a significant portion of these patients are misdiagnosed initially. So this may require some additional analysis in the future as to which one of these subgroups are being misdiagnosed in terms of the location and the diagnostic patterns. The majority of the patients are reporting that they have not received genetic testing, but for those who do, the vast majority are the FAP patients who are getting the APC mutation analysis. Switching to the treatment poster, we can see that, as you would expect, treatments are all over the place for desmoid tumors since there is no standard of care. It's a mix between targeted agents, chemotherapeutics, NSAIDs. You can see that there's quite a number of options that are being pursued. For patients who do have recurrent disease, the treatments, again, are pretty varied, but we're seeing surgery, radiation, surgery followed by radiation, chemotherapy. And then, interestingly, about half of these respondents reported no reoccurrence following that initial treatment type. So following surgeries is also very interesting. So what's happening after that? So most people are having complete resections. there are amputations listed, bowel resections, etc. So there seem to be repeat surgeries for this population. So what's happening when they're having surgery? Well, most of them, according to the 112 who have responded that they've had surgery, did have continued growth. And of these 112 respondents who did have surgery, 8 of them reported that they did have an amputation. A little confusing, there were 9 responses who did answer the question about the reoccurrence after amputation. However, we can see that there is a trend that the patients who did receive an amputation still did have reoccurrence following that amputation. So again, something that we need to consider while approaching desmoid tumors in a surgical setting. So the kinds of treatments that patients and the study participants are receiving outside of systemic include radiation, which is this teal color, watch and wait, and none are about half of the selections for this question. And then how did the patients respond to each one of those treatments? Again, we're going to have to spend some time and dissect this a little bit more now that we have the an adequate number of participants answering these questions. So we will have to further dissect of the radiation, how many people did respond. And we can see that, you know, a quarter of them did have continued growth, etc. So how many patients are receiving multiple treatments? Well, the vast majority are not receiving multiple treatments, which is good. But when they are sequencing through treatments, let's evaluate what kinds they're getting. So you can see on the left, first treatment given is often surgery. However, when you go into the second and third treatment, you're switching from mostly surgery to chemotherapy to also this radiation piece of the pie does get bigger. So again, interesting data that we're going to be evaluating further as we continue the enrollment of this study, and then we're able to further understand these populations a little bit more. So our future work, we're going to continue to work in recruiting minorities and underrepresented populations, continued engagement for this longitudinal data. We are really interested in evaluating pregnancy data, evaluating these treatment sequencing by locations, and the pediatric data. We do have 16 respondents for pediatric patients, but none of this is possible without our study participants, our committee, and NORD. So many thanks to our committee members, many thanks to the participants and the caregivers that provide all of this data. It is a lot of information that they share. So thank you very much, and I'm happy to answer your questions during the session.